Welcome to Drive and Thrive Radio, your trusted companion on the road. Here, we share valuable tips on health, energy, and smart habits, empowering you to drive safely, work efficiently, and enjoy a life of abundance. Medicare Advantage plans, also known as Medicare Part C, offer an alternative way for eligible individuals in the United States to receive their Medicare benefits. These plans are provided by private insurance companies that are approved by Medicare. Instead of receiving coverage directly through Original Medicare, which consists of Part A for hospital insurance and Part B for medical insurance, beneficiaries enrolled in Medicare Advantage plans receive their benefits through the private insurer's network and policies. To understand the significance and structure of Medicare Advantage, it's important to first appreciate the foundation of Medicare itself. Medicare was established in 1965 as a federal health insurance program primarily for people aged 65 and older, as well as certain younger individuals with disabilities. Original Medicare is divided into Part A, which covers inpatient hospital stays, skilled nursing facility care, and some home health services, and Part B, which covers outpatient care, doctor visits, preventive services, and other medical needs. However, as healthcare needs and options have evolved, so too have the choices available to Medicare beneficiaries. Medicare Advantage plans were introduced to provide more comprehensive coverage, often bundling together services and adding extra benefits not typically found in Original Medicare. These plans must, at a minimum, offer the same coverage as Parts A and B, but they frequently include additional features such as prescription drug coverage, dental, vision, hearing, and wellness programs. Enrollment in Medicare Advantage is voluntary, and beneficiaries must first be enrolled in both Part A and Part B. Once eligible, individuals can choose from a variety of plan types, such as health maintenance organizations, HMOs, preferred provider organizations, PPOs, private fee-for-service, PFFS, plans, and special needs plans, SNPs. Each plan type has its own rules regarding provider networks, referrals, and out-of-pocket costs. One of the most appealing aspects of Medicare Advantage plans is their potential to offer lower out-of-pocket expenses compared to Original Medicare. Many plans include an annual out-of-pocket maximum, which can provide financial protection for beneficiaries with significant medical needs. In contrast, Original Medicare does not have a cap on out-of-pocket spending, which can leave beneficiaries exposed to high costs in case of serious illness or injury. Medicare Advantage plans also tend to focus on preventive care and wellness. Many offer coverage for routine checkups, screenings, and even fitness programs, reflecting a broader commitment to maintaining health rather than just treating illness. Some plans may include transportation to medical appointments, over-the-counter medication allowances, or other supportive services that enhance the overall healthcare experience. Prescription drug coverage, known as Medicare Part D, can be integrated into many Medicare Advantage plans. This is a major convenience, as it allows beneficiaries to manage their medical and drug coverage under one plan, often with a single premium. However, it's important to note that not all Medicare Advantage plans include drug coverage, so individuals should review plan details carefully to ensure their medication needs are met. When considering a Medicare Advantage plan, beneficiaries should evaluate several factors, including the network of doctors and hospitals, the coverage for specific medications, the monthly premiums, deductibles, co-payments, and co-insurance amounts. Each plan is unique, and what works well for one individual may not be the best fit for another. The Centers for Medicare and Medicaid Services, CMS, provides resources, including the annual Medicare Plan Finder tool, to help individuals compare plan options based on their location and specific healthcare needs. Choosing a Medicare Advantage plan also involves understanding the enrollment periods. The initial enrollment period, IEP, begins 3 months before an individual's 65th birthday, includes the month of their birthday, and extends for 3 months after. The annual enrollment period, AEP, running from October 15th to December 7th each year, allows beneficiaries to review and switch plans if desired. There's also a Medicare Advantage open enrollment period from January 1st to March 31st. during which individuals enrolled in a Medicare Advantage plan can switch to a different plan or revert to original Medicare. It's important to recognize that while Medicare Advantage plans offer many benefits, they also come with certain limitations and responsibilities. Most plans require beneficiaries to use a network of healthcare providers, and care received outside the network may not be covered or may result in higher out-of-pocket costs. Prior authorization may be required for certain procedures or medications, which means your provider must get approval from the plan before you receive the service. Another consideration is how Medicare Advantage plans handle coverage when beneficiaries travel. Some plans may only cover emergency or urgent care outside their service area, which can be a limitation for those who travel frequently or have residences in multiple states. Beneficiaries should review the plan's policies regarding travel coverage and consider their personal circumstances when making a selection. For individuals with chronic conditions or complex healthcare needs, special needs plans, SNPs, under Medicare Advantage can provide tailored coverage. These plans are designed to serve people with specific diseases or characteristics, such as those living in institutions, dual eligible for Medicare and Medicaid, or those with certain chronic illnesses. SNPs coordinate care and offer benefits that address the unique needs of their members. Cost is another key factor when evaluating Medicare Advantage plans. While many plans offer $0 premiums, beneficiaries must continue to pay their Part B premium. Plans may also have deductibles, copayments, and coinsurance for various services. The structure of these costs can vary widely from one plan to another, so it's crucial to understand the total potential out-of-pocket expense, not just the monthly premium. Medicare Advantage plans are also rated by CMS using a star rating system, which reflects quality and performance measures such as customer service, member satisfaction, and health outcomes. Plans with higher star ratings tend to provide better service and outcomes, so beneficiaries may wish to consider these ratings when selecting a plan. It's worth noting that Medicare Advantage plans are required to follow certain rules set by Medicare, but they have flexibility in how they structure their benefits and costs. This means that plans can vary significantly in terms of coverage options, provider networks, and additional benefits. Beneficiaries should carefully review plan documents, including the summary of benefits and evidence of coverage, to understand exactly what is covered and any restrictions or requirements that apply. The popularity of Medicare Advantage has grown steadily over the years, with more than half of all Medicare beneficiaries now enrolled in these plans. This growth is driven by the convenience of bundled coverage, the potential for lower out-of-pocket costs, and the availability of extra benefits that enhance overall health and well-being. Despite the advantages, some individuals may prefer original Medicare, especially if they value the flexibility to see any provider that accepts Medicare or have supplemental coverage through Medigap policies. Medigap plans help pay for some of the costs not covered by original Medicare, such as copayments, coinsurance, and deductibles, but they cannot be used with Medicare Advantage plans. As the healthcare landscape continues to evolve, Medicare Advantage plans are likely to offer even more innovative benefits and services. Telehealth, for example, has become increasingly important, and many Medicare Advantage plans now cover virtual visits with healthcare providers. This can be particularly valuable for individuals with mobility challenges or those living in rural areas. In addition to medical coverage, some Medicare Advantage plans have begun to address social determinants of health by offering benefits like meal delivery, home modifications for safety, and support services for caregivers. These enhancements recognize that overall health is influenced by more than just access to doctors and hospitals. For prospective enrollees, the process of choosing a Medicare Advantage plan begins with an honest assessment of one's healthcare needs and priorities. Consider factors such as existing medical conditions, preferred providers, prescription drug requirements, lifestyle, and budget. It's also wise to anticipate future needs, as changing plans outside of the designated enrollment periods can be limited. Working with a licensed insurance agent or using official resources like the Medicare website can help clarify options and ensure that beneficiaries make informed decisions. It's essential to review all correspondence from Medicare and your chosen plan, as terms, premiums, networks, and covered services may change from year to year. In summary, Medicare Advantage plans represent a dynamic and customizable approach to receiving Medicare benefits. They combine hospital and medical coverage, often include prescription drug and extra benefits, and provide coordinated care through private insurers. While they offer many advantages, including the potential for lower cost and broader coverage, they also require careful consideration of networks, costs, and coverage rules. As more Americans reach Medicare eligibility, understanding the choices available is key to achieving the best possible health outcomes and financial protection. Whether you opt for Original Medicare or a Medicare Advantage plan, the goal is the same: accessing high-quality, affordable healthcare that meets your individual needs, both now and in the future. By staying informed, comparing options, and periodically reviewing your coverage, you can ensure that your Medicare benefits continue to support your health and well-being as you age. With the right plan in place, Medicare Advantage can be a valuable resource, offering peace of mind and comprehensive care for millions of Americans.
And subscribe to Drive and Thrive Radio channel so that the channel has the motivation to create many other valuable videos in the present and future.